As the leading professional association dedicated to infection preventionists, APIC provides the resources, thought leadership, education, and comprehensive training to help you protect those in your care. More than 15,000 IPs globally depend on APIC to help them develop and manage top-tier infection prevention and control programs. Join APIC today and unlock exclusive benefits such as educational content, access to cutting-edge research via our journal, and networking with peers to propel your career to new heights.
You are listening to the 5-Second Rule podcast presented by APIC, the Association for Professionals in Infection Control and Epidemiology. This podcast is produced by the APIC Communications Committee and is intended to be a conversation between our hosts and professionals practicing in the infection prevention and control industry. You will learn and be entertained, but most of all, we hope you will be inspired by our community and the work of our peers. And now, on to the show.
Welcome to the 5-Second Rule podcast. We are your hosts. I am Lerenza Howard, and my preferred pronouns are she, her.
And I'm Kelly Holmes. My preferred pronouns are also she, her.
We have a phenomenal guest today, Chris Smith, who is currently a program manager for APIC, acting as the program manager for the Missouri Kids IPC Toolkit project. She has worked in the public health and medical fields for the last 30 years, primarily in environmental health, emergency management, project management, and training, and exercise development. Welcome to the show, Chris.
Thank you for having me. I'm excited to be here.
Thanks for joining us, Chris. You have such amazing experience that you bring to the table. And I'm really excited to talk about the Missouri Kids IPC Toolkit. I have kids that are in public schools in Missouri, so this is definitely near and dear to my heart. So I'm excited to hear about it. Tell us a little bit about the partnership. What is the toolkit? Kind of, introduce our listeners to what this project was all about.
Sure. So the Missouri Kids IPC Toolkit project came about from a partnership between the Missouri Department of Senior Services and APIC with workforce development funding from the CDC. And the impetus for the project came after COVID, when it was very clear that there were a lot of education and guidance needed for the Missouri schools around infectious disease prevention and control. And the project was really designed to meet that educational need and change behaviors around infection prevention in K-12 schools in Missouri. So the toolkit itself is a compilation of resources for the entire school community around basic infection prevention and control principles. So we created the resources to really target specific audiences in ways that are most effective to reach them. So included in the toolkit, we have e-learnings, which are short courses really on the basic IPC topics that are targeted for staff and students. And they're also based on roles with more targeted education to key staff, such as the nurses, custodians, and facilities personnel. Our topics are really the IPC basics. We talk about basic infection prevention and control, and we also talk about standard precautions, respiratory etiquette, hand hygiene, cleaning and disinfection, managing illness, personal protective equipment, hierarchy of controls, indoor air quality, water management, and foodborne illness. So most things I'm sure your listeners are very familiar with in their work in infection prevention. We really just apply it to that school environment. And so then we also have different things that support those e-learnings in the same topics. We have posters that align with those topics designed for hanging in the school. We created those in English and in Spanish. We created some checklists and job aids and sample guidelines to really help support that education so that the staff have basically, they can create policy from that, or they can just use them to help remember the basics of these certain critical elements of infection prevention and control. We also have messaging home to parents. So we know that's really important, that communication out to parents. So we have letters home to the parents in English and in Spanish. And we have some social media posts because we know that's a great way for schools to communicate out to their families and also to the students and the teachers as well, or the staff. So we have those social media posts around these basic topics. We have some supporting materials that help kind of go along with the e-learning. So we have student lesson guides for the kids on certain subjects, so kind of some of the basics. And then we also have some staff lesson guides that really serve as a tool to help support perhaps an in-person discussion around certain areas, like cleaning and disinfection with the custodial staff.
Wow, Chris, that's a pretty comprehensive toolkit. And just like Kelly, I have children within my respective state that are in public school as well. But I'm very curious because the toolkit, it sounds like encompasses or it's directed towards a plethora of stakeholders, including the students, the school staff, families as well. So in consideration of pedagogy, how is this content tailored for the respective groups?
That's a great question. So we really based the entire toolkit on a needs assessment that we conducted at the beginning of the project. That was our very first thing that we did. We contracted with a company called ICF, and they helped us work on the needs assessment and also the evaluation of the materials. But our development process really was very deliberate and intentional. We took the first 60 days of development to really look at what was the specific need within the state of Missouri. And so that really drove the entire scope of the project. So we interviewed a lot of key stakeholders to determine really what were their needs, what topics did they need education or support with, who needed the information, in what format did they need it, and what were their limitations. And so what they really told us was the entire school community needed to be involved, but there was also a need for targeted education for the key groups, such as the custodians on cleaning and disinfection. They also told us the materials needed to be accessible online. They wanted short snippets, easy to digest, and the written materials really to be able to be customizable for the school per the school policy.
Thank you for sharing that. And I know that one of the areas that may have bolstered your performance, because I know that based on the information that you share with us, 90% of participants reported that they were likely to use what they learned from the IPC toolkit. So share with us, how was the effectiveness measured?
Great. Another great question. So again, we used this company called ICF to do an independent evaluation for us, which was super helpful. We gathered data, basically qualitative and quantitative methods were used. We incorporated surveys into the toolkit. So as the participants participated in our pilot, basically they took some before and after surveys. So that measured effectiveness and also what did they learn from taking the materials in the toolkit. We also did some virtual interviews with school nurses and other subject matter experts that participated in the pilot, trying to get their observations and feedback on how did they feel about it and what did they learn and would they apply what they learned. So we really did this with 8 school districts across the state. We recruited them to participate, and then we also asked them to basically provide people with the various roles that we are targeting in the toolkit from each school district so that we got a flavor of, all of those target audiences and data and feedback from them. So what we asked of the 8 school districts was basically have the pilot participants take the e-learnings and review all the material that was appropriate for their role. And then again, we got the data from the surveys that they took before and after, and also from the interviews. Yeah, we're very, very excited about the data and feedback that we got from their reactions to the materials. It was really, like you said, overwhelmingly positive, and they were so excited really about materials that we came up with and felt like we were really on target with what they needed, which was super encouraging for everybody that worked on the project, and it really supported the process that we put in place to get to that point. We also got some great feedback on ways we can improve the materials, which we've incorporated into our next version that we hope to implement this fall with the schools. We also got a really, really great detailed report from ICF on the evaluation so that we can share that with others as we go to implement the toolkit in the state.
That is a very comprehensive approach. I love how you did the pre-needs assessment and the post-assessment, and then tailored the material to make it accessible and even better in your next version. And then you also presented this year at APIC, right? And I noticed in the description for the session that you referred to using the TEAMS model. And so that is training, education, assistance, mentorship, and the S is for support. So, that's the first time that I've been introduced to the TEAMS model. So, tell us a little bit more about it, and how did that help you be successful with this endeavor?
Sure, it really was a nice dovetail. And the way this came about, Missouri had been working on a project that encouraged schools to adopt this TEAMS approach for managing infectious disease in schools. So just like in a hospital, the nurse can't do it all, right? And some schools don't even have a nurse. They may have a health aide. So they hopefully can guide and educate and monitor, and of course do so much more. But when it comes to implementation of policy and culture, that really needs to come from the entire community. And so this TEAMS approach really was setting a foundation for that kind of a concept to go into the schools and say, hey, you guys need to come together as a team to help prepare for and manage infection prevention in the school. So this was super apparent after COVID because the school nurses were really overwhelmed, and they needed that support from the rest of the key departments within the school. So this concept really has been well received by the schools that are participating in this project. So that KIDS part really stands for keeping infectious diseases out of schools by this TEAMS approach. So we really love the approach, and it dovetailed so well into that. So part of our training is really on this TEAMS concept. How can they create a team? And then how do they operationalize that team? So the idea is each school has a school district has an IPC team that should meet regularly to create and implement policy. We also hope that they would monitor the level of disease in the community and the school, and then identify those mitigation and response measures that can be put in place to control the spread of infectious disease within their school and their school districts. So as we did that, we looked at the different levels of response that, they might need to take. So, they have everyday IPC measures in place. If they're doing their monitoring, hopefully they're picking up when they have a spike in disease within the school or in the community. So we call that like an elevated level. And then another level where now they've got an outbreak in the school. What can they do different? What kind of tips and strategies can they put in place to help manage the situation and hopefully control it and keep it to a minimum at these three different kind of levels. And we look at really in an all hazards kind of a way. So I know hospitals are familiar with this. Some of our regulatory bodies use that all hazards term, and emergency management we do as well, to just really look at it from the broad spectrum, not specific to any certain disease, but infectious disease in general. So general principles. We also really focus on the relationships with the community, healthcare providers, and local and state public health, because what we recognize, we can't possibly teach them everything within this toolkit and these resources. They don't have the time, and we don't want to go that deep. But they need to know who their partners are at local, state public health and their healthcare providers, so that when they do have an infectious disease outbreak or situation occur, they know who to go to for help, and they know the general principles to apply within their school before they go ask for that specific help. So that's the concept.
Chris, I love that comprehensive approach. And I, was reading through the executive summary and noticed that, after this pilot study, that people were reporting an increased awareness around the attitudes and beliefs that infection prevention concepts in schools is, a multidisciplinary approach. It cannot just fall all on the school nurse. So I think that, this is really amazing education to provide so that it is a team-based approach. So it sounds like that was a great way to tackle it, and also that you had a lot of success with that model.
For sure.
Absolutely agreed, Kelly. And of course, as I noted, my children, I live in Illinois. So, and I see the benefits of such an project, being instituted within, my children's school system. So are there any plans beyond this project to expand this to other states? But before that, share with us the status of the project in Missouri.
Sure. So we're working right now. We've made our revisions to all the products. Currently, it's over with the state health department, and this is the school health program that has really, led us with this project over there. We're working on final approvals with them so that we can actually publish it and put it out on the website. It is going to be, free to the Missouri schools for our contracts for 5 years. So we're going to host it for them for 5 years. But hopefully it'll come out this fall. We're really excited about the project and the whole, the product, the way we loved our process that we went through to get to where we are, and so excited about, the reception that we've gotten from the schools and all the stakeholders about the need for this resource, and really, really hoping that Missouri implements it as much as they can. But we would love to see other states adopt the resource. The thing that we did that's interesting with this project is we really looked at the Missouri regulations, the guidelines that they had in place, not only with the health departments, but also with the departments of education and any of the key stakeholders at the state level, so that we could adopt, the principles and the materials and target it specific to what they already had in place. So we definitely did not want it to conflict with anything that they already had in place. We wanted it to enhance it. We didn't want to replace what they had. So it really was created probably 80% that's generalized, and then the rest of it we really customized for what was in place for Missouri already. That being said, a lot of the states are different, how they manage public health as far as regulatory guidelines and how the state and locals work together. We also looked at the CDC resources as well, though, to make sure that we aligned with CDC. So that in itself was challenging for us. But what I guess I'm trying to get to is other states could adopt this toolkit. We would have to do some analysis, and, a needs assessment is really the best place to start, just like the process that we followed for this. But it could be adopted to other states. Again, doing that look to see what do they have in place for regulatory, making sure that we were consistent with all of that and the processes that they have in place.
Thank you for sharing that, Chris. I could foresee this, spanning across multiple sectors within respective states. Do you foresee there being any additional partnerships or collaborations to enhance the toolkit's reach?
So the collaboration really with public health and education partners is key to take this resource to other states. We recognize how important it is for our students to be in school to achieve their learning objectives. And this toolkit really hopefully helps to prevent absenteeism due to illness. We can't control a lot of the other reasons kids are out of school, but what if we could prevent them from not coming to school because they're sick of an infectious disease? That alone could cut down on the chronic absenteeism that we're seeing really across the country right now. So those are really key partners, and looking at it from how do you actually implement this and make sure it applies to everyone, the state level is really the best way to approach that, in my opinion, because there are a lot of regulations that go alongside infection prevention, nursing, public health that really impacts the school. Absenteeism, reporting, vaccinations, a lot of those things, exclusion from school, those may be driven by regulations at the state level. So it's really important to have those things in place and those partners involved in any kind of development.
Oh, I love that, Chris. What about future considerations to include additional things? Do you see it expanding into bed bugs, lice, other day-to-day challenges that those school nurses are facing? Is this kind of a framework that could encompass how to deal with those things as well?
Yes, we do have some resources for bed bugs and lice. There are so many things that we could cover. We've got some letters home about that. But we did hear from the schools that they're definitely challenged by bed bugs and lice. It's not, what we think of as an infectious disease. It's more of a pest situation, but it definitely causes them a lot of heartache and headaches in the schools. And unfortunately, it falls to the nurse a lot of times to help manage that. And so, as we know, it's not just a nursing situation, but they certainly could use all the guidance they can get on how to manage that. What do they do when a child comes or is sent to their nurse's office with a bed bugs or lice? How do they deal with that? And guidance on lice has certainly changed over the years and gotten less restrictive, but people still want to be very proactive on it while still maintaining that balance of how do we keep the kids in school to achieve their learning objectives. So definitely a hot topic, and we hope to provide more. If we can continue the work, we'd love to provide more resources on that.
That is wonderful. And then, I'm thinking about just in my life and my friends who are school nurses, and I'll be talking about this, and I'm sure they'll be like, oh my gosh, where can I get that information? Right. So, how do you envision operationalizing that? Is that the school nurse's position really to go out and get this resource and then bring it to administration? Or is it more of an administrator that is going to go out and get this toolkit and implement it? How do you envision that, being operationalized by a school who was not part of your pilot?
Right. That's another great question. How do you implement it? Because it's a great resource, as we need people to pick it up and use it, right? It was very interesting for us to see who of those key roles within our pilots, who was most interested in what products. And it was the administrators that were most interested in the e-learnings because, they're responsible for making sure that their staff are trained. The teachers really love the posters. The nurses like the sample guidelines that we put out. But if you look at who can implement change within an organization, a school district, it's generally the administrators who can make that change most effectively. So what we hope to do is really provide education out to the school nurses. We hope that they can be champions for this toolkit and these resources. And, the ideal world is they already work with their health department, they work with their administrator closely, and they can kind of work as a team to implement this within the school. But it is going to take the administrators to be a champion as well, recognize the importance of the toolkit and this education, and, tasking their teachers and all of the other supportive roles to take the toolkit and use the resources.
Absolutely. And then you had mentioned how you targeted all roles within the school system. How difficult was that to make that language accessible to those outside of a traditional healthcare setting? And who helped you guys accomplish that?
Yeah, that was one of our challenges, actually. So one of our goals from the beginning was to try and make sure that the materials that we provided were in plain language. And that means different things to different people. But what we really decided was the best way to do it was get an expert involved, because what I think is plain language may not be, what other folks think it is. Trying to target a certain grade level, that was difficult for us. So we actually worked with a company called Health Literacy Media, and they reviewed all of our materials to make sure that we were using language that was really understandable by all. As we all know, a lot of IPC is jargon. It is technical terminology, medical terminology that the normal person just doesn't know. They don't live in that world and they don't speak that language. So how do we actually speak in a way that everyone can understand? So that was a big target for particularly the e-learnings. And the posters, of course, those are targeted at the children. So we made sure that those were in the appropriate grade level. We also translated our materials into Spanish, not everything, but things that were appropriate, like the posters are in Spanish as well as English. The letters home, Spanish as well as English, because that is the primary second language in the state of Missouri. And so we had a subcontractor that helped us with that translation as well. But we felt like those were two ways that we could really try to target and make sure that people could understand the words we were using. We've got some really great visuals that support the wording. So that again is a piece of that plain language and health literacy that we tried to incorporate.
Chris, that's phenomenal, because I think that's important to highlight when instituting educational materials, especially something so expansive as educating the 8 school districts across Missouri related to IPC, to ensure that you're incorporating measures of equality and also instituting measures of cultural and linguistic awareness. So I really appreciate that approach, because I would imagine that contributed to the success that you've seen thus far with this initiative.
Yes, I think so. I think we got a lot of feedback on that they felt like we really spoke to them in a way that they can understand. And even a lot of them, the reason we actually started to expand it into teaching the children as well is because they said, hey, this e-learning, I understand it, but my students will understand it too. So I'd love to show it to them and share it with them so that they also get the experience of the e-learnings.
Absolutely. And I know that, of course, COVID has taught many different institutions and or sectors the importance of infection control, especially, with the onset of the COVID-19 pandemic. And I could, see this project being instituted in other industries, including, film and entertainment, or, even cruise ships, because we've learned of infection prevention professionals being hired in those industries. So based on your experience with this project, how could this toolkit be utilized in instances in other industries, or in industries such as the ones that I named?
Yeah, it really is a great resource for anyone in a lay environment, right? So we at APIC have generally focused on hospitals and care settings. But if you look at the rest of the world, we all come together in crowded places quite a bit, right? And these infection prevention basic foundations really carry through. And a lot of it is public health, right? And how do we get that into the hands of everyone that needs to know it? A lot of the CDC materials you'll see out there, they focus on a certain disease like the flu or COVID, of course. Lots of stuff out there on that. But there's not a lot of materials that are really this all hazards level, or trying to just target infection prevention in general with these key concepts. And so, yeah, any time you have people that are together, and particularly we know places like cruise ships, they're closed environments, very close quarters, places like correctional facilities, group homes, even I know this applies to daycares as well. There's a lot of different environments where these materials could be used, adapted and used to those environments that would be very beneficial.
Well, thank you, Chris. This information that you share with us is phenomenal. As I learned about, your initiative in this project and how it, pointed, you created or focused your education on a pointed audience or targeted audience, and you catered that education to the respective stakeholders. But then you have intentional efforts in effective pedagogy and effective educational tools and styles that will be impactful to the population of focus. But then in addition to that team's approach in preventing infections within our school system. So I thank you for your time and for joining us today, Chris.
Yes, I echo what Lerenza said. The potential of this toolkit is significant, not only for schools, but it translates into healthy practices in the community. And hopefully we will just grow from here. So thank you for joining us, Chris, and sharing the story.
Thanks so much for having me. I really enjoyed it.
Thanks for listening to APIC's 5-Second Rule Show. We want to hear from you. Visit us at www.5secondruleshow.org. That's with the number 5, where you can contribute to the conversation. Make sure you subscribe and rate us wherever you listen to your podcasts. We're so appreciative of the hard work each of you do every day to make a safer world through infection prevention. Remember, IP stands for Important Person. You are awesome. Stay safe, and we'll see you next time.